do you want to start? Do you want to start with
Let's start with the foster care.
foster care? Okay, what was your position?
I was a foster care social worker, and when we would get new kids into our agency, because I worked for an agency, not the county, if we didn't have proof that those children had been vaccinated, the foster parents had to go out immediately within a week to the doctor, and they would just catch them up on their vaccines. There was no attempt to find out if they had been vaccinated unless the parents were running after them, handing them their vaccine cards. They just vaccinated them. And parent choice plays in a lot, like on haircuts and how kids dress, but it plays no role in if the agencies have to have the children vaccinated immediately. And they'll go back a month later and get boosters. Like they need a booster a month later.
Did you ever see like how much they got? I mean, was it just literally the lot?
Yes.
All in one visit?
Yes. And then a month later they'd go back and get boosters.
And how were they?
You know, these were kids that were really not in a good place to start. And I would say they just kind of shut down. Now, I don't know exactly why, but it freaked me out. And I wasn't even, vaccines weren't on my radar at all then.
Did you ever question why these children, no one was investigating whether they'd had the shots?
I did. And I was just told that it's safe to give it to them even if they've already had them. So we're going to give them to them to keep them safe. That was what we were told.
Terrific.
Yeah. And sometimes the kids would get sick. I mean, we would see fevers, and I never saw some of the more dramatic things. These kids were a little older usually when that would happen. I remember one family, there were 5 children, and 3 of them were in one foster home, and they were like 8, 10, 12, right in that age range. And so they didn't have the symptoms you usually see with infants and toddlers, but they were not doing well. And a lot of parents in the foster care world honestly didn't really think the vaccines were the greatest thing in the world, but they gave them anyway. We adopted a son and a daughter out of the foster care system, and we brought our son home from the hospital and when he was an infant, and we had to give him his vax. We had to give them on schedule or they would have taken him away. We adopted him, and we immediately slowed it down. We started spreading everything out so that he wasn't getting all of his vaccines on the schedule that's demanded.
That's awful. It's really sad to hear that. These poor vulnerable children that had it awful to start with, and then they're just used it just breaks our heart. Okay, thank you for that. Well, that's an area that we all need to campaign for at some point. Let's talk about your children.
Okay. We had our daughter Megan, who had Down syndrome, and then we adopted other children who had issues out of the foster care system. And it gave us an opportunity to bring in some income while at the same time being able to care for kids that oftentimes aren't cared for, because foster care isn't always the best place for kids to live. There are a lot of people there that are just there for the money. And we ended up adopting kids, and my husband told me we had to stop doing foster care because I wanted to adopt every kid who came into our home. I told you about our son. Our daughter, who's now 20, we got her when she was 5. And I agreed to give her the Gardasil shot when she was 12. She has brain injury already because her biological mother drank while she was pregnant. She's been diagnosed with fetal alcohol spectrum disorder. And I think when a child's already got a brain injury, the vaccines just have that much more opportunity to hurt kids. And she went into immediate brain fog. And I tried to call the doctor's office after I was like, wait, I think this might be the vaccines, because it all started right then. And I looked up the report, how to report a suspected vaccine injury. And I was told, or I found that you had to have the lot number. So I called the doctor's office. They wouldn't give me the lot number. I was like, well, why not? I just want to report that I suspect my child was injured. So, oh, no, we're not going to give you the lot number. And I said, well, isn't it part of her medical record? And I said, no, we don't put that in their medical record. Well, I'm sure they had to, but they wouldn't give me the information. And fortunately, oh, and they also would not give her, they would not make a report. Fortunately, her brain fog cleared up after about 4 to 6 months. And we started seeing it clear up in 4 months. And by 6 months, she was pretty much back to her old self. But we've never given her another shot because that one definitely had an impact on her. And then my daughter Megan is our most dramatic story. She was our only biological daughter. She was born with Down syndrome. And kids with Down syndrome have a couple of issues that make them more susceptible to problems from vaccines. They have methylation problems because of the third copy of the genes. They're more likely to have issues from any kind of toxin. And then there's also an increased risk of mitochondrial dysfunction. When Megan was born, she had a heart condition called tetralogy of Fallot, and it's also known as blue baby syndrome. And she had a 3 out of 10 on her physical profile, so they said, well, we got to take her today because she's not going to make it. And when she came out, she was blue, and they pinked her up, and they had to do some surgery the day she was born, just some minor stuff, and she spent 4 weeks in the neonatal intensive care unit. She had tetralogy of Fallot, transitional pulmonary hypertension. She was very weak. She had very low muscle tone, so she couldn't feed on her own. And at just over 3 weeks, they said, well, if you want to take her home sooner, we'll give her a feeding tube, and then you can take her home. And we wanted to take our baby home, so we said yes. I would not do that at this point. I mean, if I had it to do over again, I would have just gotten her eating, because that's really hard to get a kid eating when you're feeding them through a feeding tube. She had very severe GERD very early on, and she would throw up 25 times a day on average. And she was on lots of meds. She was on an experimental medication called nitric oxide that pushed the oxygen out to her extremities. And it saved her life. But I've also always wondered what it might have done, because it was experimental. At 5 months, she had to have open heart surgery. And we were supposed to be in the hospital 3 to 5 days, and we were there 3 weeks. For 2 weeks, she was in an induced coma. She's on more medications than, and she was on over 30 medications. You know, those trees that the IV pulls.
Were they vaccinating her at this point?
They were.
While she was so sick?
They vaccinated her before, not while she was in the hospital. But there were a lot of experimental things going on. But she pulled through, and really, the doctors were telling us, we're not sure you're going to take her home. But we took her home, and she's doing great. And her doctor said, this is the most advanced kid I've ever seen with Down syndrome. And he was the one they referred all the kids with Down syndrome to, because he wasn't afraid of them. And she rolled over at less than 2 months old. She had an arm under her, so she had a little bit of a, help, but she was doing beautifully. And by the time she was 2, she had 10 words. That's pretty amazing for a kid with Down syndrome. They tend not to start
pretty
talking.
Amazing for a vaccinated child, to be honest.
Well, then she got those 2-year vaccines, and we saw she went back to 2 words. She stopped moving around. She stopped trying to do anything except hit herself. And she would hit herself 100 times an hour at school. It was documented. She ended up with numerous sets of ear tubes. She ended up with, she had sinus infections all the time. She just, it like all fell apart after those 2-year vaccines. We finally got her into a great school where she was learning and she felt loved and protected, and she started to come through. We were doing a lot of the diets and getting rid of anything we could, all organics. With the feeding tube, they had us giving her this food, and we stopped doing that. We started blending and pureeing, all organic, all natural, and we saw her doing better. But she still, at 15, was not talking much.
So she's 15 years old now, not talking much. And were they now making you vaccinate, or because she's your biological child?
We had talked to her doctor, and he had said, "Oh, you can't not vaccinate the measles and chickenpox. They're fatal diseases." I'm like, "No, they're not. I had the measles, and everybody that was at my babysitter all got them. We got them on purpose." And he's like, "Oh, but there are kids that die," not telling me that they're in third world countries where they've got other reasons why they're dying because of illness. But he did agree at that point to do titers. So he would draw blood and see if she had immunity. She had so much immunity to chickenpox. He was like, "She's never going to need this." I mean, it was super hyperimmune. And so we didn't give her any more of the things that she was immune to. But I mean, she would be 18 now. This was really early on, and I didn't see that big seizures she had fevers after all of her shots. We gave her Tylenol after all of her shots. I didn't see that big thing that made me think, "Oh my gosh, she's having a vaccine reaction." But knowing what I know about Down syndrome and their issues, and I even asked if we could get her tested for mitochondrial dysfunction. "No, it's too expensive. No one will pay for it." I mean, it was just like I was too passive. And I warn parents now, don't be passive. Don't go along, because when my daughter was 15, she had a medical issue. And she couldn't tell us what was going on. And she died. And if she could have talked, we probably could have saved her. And so I blame myself. I blame the schools for not getting her what she needs. Her legacy is that now I work my butt off to help other families so that they don't have to go through what we went through. Kids need to learn to talk. Kids don't need to have this stuff taken away from them. I can't prove anything about the vaccines with her, but I know, given the fact that she had the Down syndrome, and they didn't want to do they didn't want to do an autopsy. They told us they thought it was pulmonary embolism, but they didn't have any chest tubes draining the blood from her lungs. So how could she have had a pulmonary embolism and started breathing again later if they hadn't pulled the blood off of her lungs? It doesn't make sense. And I'm especially pushy with parents to not just go along to get along, because our kids' lives depend on it.
Well, I'm so sorry. We're all really sorry. You've had a tough time.
She was an amazing kid. She was a pain, and she was funny, and she's the best thing that ever happened to our family. And poof, she was gone in 8 hours, 6 hours.
Horrific. A lot of people here sending you love and saying you're an amazing mama, and
I wish I'd been more amazing earlier.
you know what? We were all lied to. with these vaccines. We were like, every time your daughter was sent for more invasive tests, every time they vaccinated her, you just did what you, like we all did. We all thought we were doing the best thing for our babies.
Yeah.
So
I just hope people learn that they can ask those questions before their babies are hurt. And why
ask
we're
questions all you
giving
like. Just don't trust the doctors, guys. I'm sorry, it's got to be that.
and why we're giving
God, that's the stage I'm at
newborns
now.
we give newborns a shot for people who are sexually promiscuous and IV drug users. I mean, why is that important to give to newborns? There's no reason for it. And the whole Gardasil thing, there are other ways to avoid getting HPV. I mean, we teach our kids not to have unprotected sex, and you're not going to get HPV.
Did your daughter get HPV?
No.
That's, at least that was one good thing.
Well, I don't know if she got it from the vaccine because we.
No, but I mean, did you get the vaccine? Did your daughter get Gardasil HPV vaccine?
Megan didn't. Ashley did, and she's the one who had the brain
Yeah,
fog
I didn't tell us
reaction.
about, but Megan didn't. Okay, good.
Yeah. Once Ashley had that reaction, we were not going to give it to our other kids. We were done. And it was
Okay.
really then that I realized I have to protect them from all of them.
Now, do we have your children's names on the bus?
No.
Can we go and put them on the bus?
Sure.